Uxbridge Physiotherapy, a private physiotherapy rehabilitation clinic providing quality care since 2002. Located in downtown Uxbridge, the clinic offers a qualified and dedicated team to help get you moving and feeling better. After completing a comprehensive biomechanical assessment, the team of healthcare professionals will determine the appropriate treatment plan for you. Led by Jodi Bussiere, and we're here right now with Jodi, and it's Scott Campsall that joins me on the phone as well. Good morning, Scott.
Good morning, Dan.
And good morning, Jodi.
Good morning, guys.
So we, well, you know what? That kind of sums it up, so I guess we're done. No, what we wanted to do, though, is kind of review for people, and I think it is important at this time, what the clinic is about, what you guys offer, because I know in some cases, you were telling me that, in some cases, physicians are not doing one-on-ones with people, and they may be out there living in pain that you might be able to help with. Is that right?
Well, yes, and just to clarify, doctors are definitely working. They've been working really hard right through COVID. I think a lot of physicians still aren't seeing patients in person. They're doing a lot of virtual appointments, and they're doing phone appointments, which is really great, and we can really do a lot that way. Our clinic opened up, as you know, to seeing people in person on June 1st, so we're into our, third or fourth month now, and I'm finding it's really nice complementary care with the doctors where we're doing, as always, our really detailed assessments that take us at least an hour. We summarize our findings and we send our findings back to the referring doctors by way of a letter. And it's great communication with the doctors. Often I'm finding the patients are saying that they're hearing from their doctors after seeing us within short period of time, like a couple of days, and the doctors are able to arrange consults or x-rays or other follow-up based on our findings. So again, it's great multidisciplinary care, and it's good for marketing for us because the doctors are continuing to see what good work we do in all the different areas that we treat. So,
do you ever find that somebody comes in and says, I've been living with this pain? A lot of people play through things and play through pain, and that somebody walks through your door and you go, well, actually, no, we deal with that an awful lot, and here's some things we can do, and people don't realize that they don't have to live in pain every day.
Absolutely. I would say I can't give you a percentage, but we certainly have a lot of patients that come in that have a known injury. So I sprained my ankle, I've had surgery, my doctor told me I have a rotator cuff tear, et cetera. So that's maybe there's a little more direction right from the get-go. But then we do have a great deal of patients that come in and say, I've had this leg pain for 2 years, and, no one else has been able to fix me, and I heard a lot of great things about your clinic, so what can you do to help me? And, I did an assessment yesterday. I told this lady it's like my detective work. I have to then take a good history, as we always do, and ask them lots of questions which give us clues, and then find out what makes them hurt and what makes it better, and then we do our assessment based on our findings and come up with hopefully a cause for the pain, and then that's how we treat it.
Now, have you?
Oh,
sorry. Go ahead.
To add to that, we had a student that after their vestibular rehabilitation program. I'm sorry, I'm getting corrected by my wife. But that show we did then. We referred a student over to you guys, and he came back, and he's not at 100%, but he's definitely said he's seen some improvement just doing some of the exercises that you guys prescribed for him. So, but he was the same way. And that's actually what made us, or what made me talk to him was, I said to him, you might want to check this out. And he just sort of accepted that all the problems he was having was just him.
Well, thank you so much for the referral, Scott. And honestly, this is the way I've been operating since I moved to Uxbridge in 2010 with the multidisciplinary care. And I don't know if we've talked about it on the radio, but I have a journal club where it's probably 40 or 50 different healthcare professionals in the Durham region. And we get together and we have guest speakers and we talk about all our different professions and what we do. And as soon as you find out that somebody is doing something that can help one of your clients, we work together, and it's good for all of us. It helps all of us out in our businesses, and it solves some problems that some of my patients have. Maybe they need a trainer, or they need, they need some karate or they need some fitness classes, and you and Jen can help them in that regard. So, yeah, it's great. It's great to work together.
What is the difference between getting a massage and massage therapy?
Sorry, one more time.
What's the difference between getting a massage and massage therapy?
Oh, no, I told you you're not allowed to ask me questions.
Well, I don't know if there was a difference or not.
So let's just to clarify, the massage therapists that work in my clinic are registered massage therapists. So they're registered with the College of Massage Therapists of Ontario. And to be honest with you, I don't know if massage therapy or massage is a controlled word. What that means is, can someone say that they do massage that's not a registered massage therapist? I'm getting a bit technical, but it's the same with physiotherapy. And this is kind of disturbing, but you can actually say that you do physiotherapy and you're not a registered physiotherapist. So
really? I had no idea of that.
Yeah, you'll see clinics out there that have physiotherapy on their window, but you have to be careful if you're going to be claiming it through your benefits. Your benefits will not cover it if you're not having treatment from a registered physiotherapist. And that's there to protect the public, and it's there to protect people from being misled. But anyway, back to your original question.
Well, actually, before we go away from that, though, so if you're looking at, say, example, you walk by a storefront, you see that the physiotherapy offered. Are there letters that you should be looking for to know that they are registered, or?
Yeah, you go in and ask if you have registered physiotherapists working there. And just to clarify why that might be that someone might write that, physiotherapy, remember, is using physical modalities to treat people's mobility problems. So that's what we do. We use manual techniques. We use exercises. We use different physical modalities like acupuncture machines, et cetera, education. There's a lot of things that we do. So I guess there's people like, I don't want to name professions, but there's other related fields that they can use that word. They can say they do physical therapy, but they aren't registered physiotherapists. So you just want to be careful if you're wanting that care that we provide, that you have a registered physiotherapist, because they're not going to have a billing code.
Right.
And you won't be able to claim it at
well,
all.
see, you say, don't ask you a question you know the answer to. You've actually answered it, because obviously massage therapy is part of, it could be part of a bunch of modalities. So therefore, and you offer that up in one clinic as opposed to just a massage.
Well, yes. And I have 2 registered massage therapists that work along with my registered physiotherapists. And I'm very careful. Like, I do soft tissue techniques in my sessions as well. I'm very careful in my charting, never to write massage. And I don't think that I'd be slapped on the wrist for doing that if anybody looked at my charts. But I want to be very clear, and I tell my patients, I am not a massage therapist. I have half an hour to do this treatment. I'm going to do 10 minutes of soft tissue release, and this is what the purpose is. But if you really need a good hour-long or 45-minute-long massage therapy session, I would like to refer you to one of my massage therapists for additional sessions. So I'll often treat my patients with the massage therapist concurrently. So they'll come in and see the massage therapist on a separate day. They'll get a really good, thorough massage therapy, soft tissue technique done on them in that session, and then they'll have the physio done separately.
Well,
and it's billed separately.
I think that's valuable information for a lot of people, because we let's be honest, most people don't know. They just fix me, and they're looking for someone.
There's a lot of things people don't know. So that's another great thing about doing these radio shows, is that people are picking up on things that they didn't know.
Well, we hope so. And from just following up on that, I understand that you had someone come out for the pole walking that heard us talking about pole walking.
Yeah, it was great. We started this week, so our first class was on Monday. We had a great class outdoors in Elgin Park, and one of the fellows that joined us, he heard our talk last month, and he called specifically because of that radio interview, and he let's just say that he's at a stage in his life where he needed the physical and perhaps social interaction of the group, and he came out. He was such a nice man, and we're so glad to have him, and it was neat that he just heard about it on the radio.
No, that
Did
is.
you hear that? We actually have 2 people listening then.
See, there you go.
We had a person talking last week, and we always say that people just turn me off, but look at that. That's 2 people.
We doubled the audience in a 2-week period. It's amazing.
My numbers are up.
Yeah. Now's the time to retire. Go out on the high. Well, listen, we were talking. We've been talking about getting there and getting healthier, but in some cases, you do need braces and things like that, and you guys do that as well.
Yeah, we do. We use Dawn Joy, which is a fantastic, I think they're an international company, and they do custom bracing as well as we can get anything off the shelf from them, but specifically for post-ACL reconstruction surgery, and as well there's something called a deloader. So patients that have osteoarthritis in their knees, it just realigns the impact through their knees a little bit, and it can buy them a few more years. So they're pretty elaborate custom braces. So we have a rep come in and fit the patient and then come back and show them how it's worn, and if there's any problems, they actually come to our clinic and meet with the patient. So it's great. We have a good relationship with that company.
Good time to just get an update. You mentioned you reopened the doors on June the 1st with new safety and sanitization protocols. Anything changed from that moment when you first opened the doors to now? Because we all seem to just be learning as we continue along here.
Right. It's definitely been a process. We were pretty slow in the beginning, leaving tons of spaces between patients. I think at one point we would see one patient and then have a 15-minute space, and see another patient have 15-minute space, which is really a lot of lost time in the day, but we just wanted to start super slow. So we're definitely still booking spaces in our day, but less of them. And the way we're able to do that is we've started taking a couple of students and volunteers again from the colleges and from around to help us clean and sanitize. But it's very different. I'm not allowing anyone to go room to room, as you can understand the reasons. So those people that are assisting us are staying outside the rooms and cleaning equipment, cleaning beds between clients, that kind of thing. But that's allowing us to be a little bit more productive, see a few more patients, but we're still not seeing the same number of patients that we were seeing before COVID. I don't think that'll change for a very long time. We have comments from patients that they're definitely feeling comfortable and safe coming to our clinic. It's pretty quiet compared to what it used to be. We're not having the gym full of people doing all their exercises. We give them a couple exercises, show them, and then they go home and do them. And then also to mention that virtual care is still an option, because there are people who need treatment, but they can't come or they don't want to come in person yet. They're just not comfortable. So we are doing a combination of in-person and virtual, just like the physicians.
That's interesting that you went through that too, because we did that too. We had everything on paper and said, this is the way we're going to do our protocols and everything. We even had a meeting with all our instructors. And then when you actually put it into practice, we're going, okay, well, we don't have to do that, I guess. But, and we can actually get away with this, or, or you go the other way, where all of a sudden you go, oh, we're going to have to implement that policy now. Or like, so it's interesting when you put everything back into practice. It's that you had to go through that too. That's very interesting.
Well, it's a process, right? And I think that it's better to, sorry the term overkill, but you know what I mean. If you do things a little excessively in the beginning, you're more clean and sanitized than you need to, and you wear gloves. Like, I change my gloves every single time I touch a different patient, and the amount of PPE I'm going through and what I'm paying for it is ridiculous. But I'm glad to do it. Patients feel comfortable, and then you just see where you're at, and you see where you can tighten up a little bit, but still maintain safety of your clients and your staff. And the teachers are going through it right now. Of course, it's not comparing apples to apples, but it's very anxiety ridden the first couple of weeks, and it's all new, and it seems really strange. but then you sort of get used to it and you take a step back and you make some decisions about how you might be able to change and move forward. But, we're not going to be 100% capacity for a very long time. So
we said the same thing about the teachers, too, that we thought the staggered start was a good way to go, just from our own experiences, just because we didn't start our schedule until August. And then in August, a lot of people were away. We could slowly get into it, and we could sort of see, okay, these classes are going to be bigger, so we're going to have to tighten that up a little bit. We said the same thing. The teachers are definitely on the right track.
Well, Jodi, we are so glad that you guys are back open again. And as you said, there's still some virtual care that exists as part of the programs as well. Stay well, and we thank you for all the great information.
Okay, great. Have a great day, guys.
And congratulations, Scott. That's doubling the listeners. Next week we could look at tripling it, maybe. You find somebody walking by in the street?
Right there. Are you listening? We'll have to do a Facebook poll or something.
Look out the door quickly and see if somebody's walking by in the street. We could triple this thing right now.
We need tech. What station are you listening to?
Guys, thanks for your time.
All right. Thank you.
Take care. Bye-bye. Bye. Wellness Wednesday, and that is Scott Campsall from Macombi Kai joining us today. Jodi Bussiere from Uxbridge Physiotherapy. Interesting conversation to find out the difference and what to look for to make sure you're getting a registered physiotherapist as well.